Many Americans mistakenly believe HIV is no longer a serious health issue, which can reduce testing and treatment rates. While medical advances allow individuals with HIV to lead long, healthy lives, early diagnosis and consistent treatment remain essential. New cases continue to rise, particularly among younger people and underserved communities. In recognition of National HIV Testing Day, today, June 27th, we're joined by Helen Everett, a CVS Specialty pharmacist, and Christopher Hooper, a CVS Specialty patient living with HIV, to discuss the importance of awareness and compassionate care. Good morning to both of you. How are you?
Good
Good
morning.
morning. Wonderful. Happy to be here.
Great to have you. Helen, many people misunderstand HIV, believing it is no longer a serious issue or that it only affects certain groups. Why is this such a dangerous mindset?
It's a dangerous mindset because although HIV is not what it was in the 80s and 90s, it's still a serious public health issue. We know that we're now seeing an increased diagnosis in younger people and underrepresented communities. So it's important we want people to get tested and find out their status and to get on medication and also to prevent further transmission, giving it to other people unknowingly.
Helen, in today's environment, why is knowing your HIV status more critical than ever?
It's it's more critical because we now know we've had years to learn that if you're positive and you start medication early, it prevents disease. You can live a long and healthy life like the rest of us. And we also know that you can give people the disease if you don't know that you have it. We know that there is people have HIV, about 13% of the people with HIV don't know that they have it, so they're unknowingly spreading the virus to other people.
Christopher, when you were diagnosed, how did you come to terms with your diagnosis?
Well, I was diagnosed back in 1992, so the atmosphere is a lot different than it is today. And the medications were a lot different, and the stigma was incredible. So it took me a long time to come to terms with that. I compartmentalized it and hid it, and then I didn't talk about it for 30 years. And it wasn't really until I think the moment that changed was when the CDC declared U equals U, which is undetectable means untransmittable. And what that means is if you take your medication regularly and you do your blood work regularly, you cannot transmit the disease to somebody else. And that was pretty life-changing. That was a moment I kind of reconciled with it a little bit and started talking about it.
Christopher, staying consistent with treatment is essential, but there's more to managing HIV. What should people keep in mind? And what advice would you offer to someone newly diagnosed?
Keep in mind that, I take one pill a day. And I get up in the morning, take my pill, and I go about my day. And so it can be as simple as that. But there are other things. And so I think somebody newly diagnosed, it's really important to become informed about your condition as much as you can. So do your research and then start building a team, and a team of your primary care physician, maybe a specialist that knows about HIV, like my pharmacist that we've known each other for 10 years. That's her specialty, and so you can kind of lean on them. And even the emotional support in the beginning, they may be the only people that you could talk to, and you can talk to them openly about the newly diagnosed, your new diagnosis, and then start building an emotional support team too. And there are organizations out there that you can find that will help you with that. And if you do have friends and family, you can help them learn about how HIV works, and that you can't transmit the disease if you stay on your regimen, and know that you can have a normal life.
You know, you're making me think about that movie Philadelphia and how it was 30 or 40 years ago for people diagnosed with HIV, especially when you
That's
said you
right.
take a pill per day compared to the treatment 30, 40 years ago.
That's right.
Very, yeah, very interesting. Helen, as a specialty pharmacist, what is the most important advice you would give to patients?
Um, to start medication right away. And like Christopher said, most medications today are a single tablet. So you have a combo and one single tablet. There's also injectable medication, long acting injectable if you don't want to take a tablet every day. And the side effects are pretty minimal if you have, most people don't have any side effects. I want you to tell me if you start the medication if you're having a problem with it. I also want you to tell a patient that make sure that they take it daily. So, and be consistent. Morning, afternoon, or evening is what I usually tell my patients. However, whatever helps you, remember to take it. Let us know if you start any kind of new medication, supplements. We want to make sure that they're not going to interact with it. And to also know that, like Christopher said, you can live a long and healthy life and not to be scared about it.
I see that smile on Christopher's face. Yeah, definitely. Helen, where
Yeah.
can our audience go for more information?
You can go to cvshealth.com.
I got one last question for both of you. You two seem like a good team. Is that what it really takes to make sure that the message gets across?
I mean, I don't think it necessarily takes that, but it sure does help.
It
Yeah.
does.
When I see her in the pharmacy, we don't really talk a lot about my HIV because it's very managed. So we get to talk about me baking cakes and her brother, and and isn't that fantastic? What a
Yeah.
new world it is.
It's definitely a new world. Appreciate it. I've been
Yeah.
speaking with Helen Everett, a CVS Specialty pharmacist, and Christopher Hooper, a CVS Specialty patient living with HIV. It's been a very enjoyable and enlightening conversation. Thank you to both of you.
Thanks,
Thank
James.
you. Thanks, James. Have a great day.
You too.